global organization, a world body.
I'd like Dr. Banasic to come up and receive the Emerald Circle.
He not only got himself certified, but he transformed a whole center into what we call an IBMS Center of Healthcare Excellence. This beautiful also certification, he had to go through a rigorous processing of certain criteria of the center. IBMS Center of Healthcare Excellence, ensuring professional standards of patient care. And this is presented for the Perfection Aesthetic Plastic and Reconstruction Center in Cancun, Mexico.
But the question is, well, how do you gauge quality of care of an organization? I have the definitions. They're universal. They're culturally sensitive. But the marker itself is applicable across cultures, any good hospital. We would want to look at protocols and processes at your hospital. The hospital should have a policy and a procedure for maintaining universal precautions for quality of care that is a measurement allowing for certification by IBMS.
I think there should be a certification process. I think that all countries will benefit from the economic impact upon their country. I think that they will improve their overall technology by getting certified, by having continuous medical education that will surpass what they can get in their own country.
In order to work closely with faculty, with nurses, doing education and training, and designing processes in a healthcare system. Understand some high-level markers for quality that cross an organization based on the model of structure, process, and outcomes. I have been teaching at Harvard Medical School and doing international healthcare quality and safety school for the past 15 years. So we're not doing research anymore. The question is, as you leave the shores and you go to the Middle East, go to India, go to other countries, because as soon as they sign up, they become patients. Some of the ethical and moral criteria need to be developed. The issue of quality and safety is most important in the industry of medical tourism, and or the markers that apply across borders, apply across cultures, that I have used in many different countries. As part of the mission of IBMS, quality metrics define a hospital, a health system, or a clinic as
organizations helps us share credentials. It provides visibility and transparency for people seeking health care all over the world. It's global in its an impression. It's something that people need, they look for, and it is something that they will want for themselves as well as their friends and families.
I am Dr. David Kalin, Chairman of the International Board of Medicine and Surgery, and it is with pleasure that I endorse Dr. Sharon Clayfield on behalf of the IBMS Executive Leadership Team as the IBMS Director of Quality, Centers of Healthcare Excellence Certification, and Professional Affiliations.
Now, IBMS has done a tremendous job in identifying a network of highly trained, credentialed physicians absolutely key. Without this, medical tourism goes nowhere. So one, we all look at unexpected mortality rates, infection rates for standardized hand hygiene by all staff who come in contact with patients. Okay. Next, patient falls. Antibiotics before and after surgery. Marker is unplanned return to the operating theater in the same admission for the same surgery. The next marker is medication errors, blood transfusion reactions. The surgical team in a hospital should be using an acceptable checklist and timeout before any procedure is started that maintain sterilization, cleanliness, and protection. The transmission of germs across healthcare staff and patients. So I guess we could patient satisfaction and the interaction of the patient in all of the healthcare communications. Some real quality and safety metrics would allow patients, facilitators to make decisions. The International Board of Medicine and Surgery. We certify centers of excellence, hospitals, clinics, and specialty centers.
Global impact of information is greater than any other.
Register now at ibms.us/certification.